Good morning, America. This is Dr. Rick, the Maverick Doctor. Lately, I've been asked quite a few questions about how come I have the name Maverick Doctor tagged on after me. A lot of that, I guess, has come over the years of trying to fight for patient rights. Fighting for patient rights is not always a topic that people want to deal with. People want to go to work every day. I'm talking doctors and nurses that want to get their jobs done, and the patient often gets lost a little bit in all the dust today, just simply because of all the requirements put on doctors and nurses. Try to think of last time you saw your doctor or nurse. How many of the things did you see them do that actually involved touching you, feeling you, diagnosing you? Listen to your heart, listen to your chest, listen to your story. What happened to your children at home? How are grandpa and grandma doing? These things are things that us old doctors did on a daily basis. I can recall always sitting on the edge of my patient's bed, holding their hand, establishing my rapport, and talking to them about what is wrong. Do you know that there was a study done years ago, and I'm recalling this for probably at least 40 years ago, but they found out that doctors who sat and talked to their patients, and that's all they did, was talk to them and did a history and physical, that that they were able to come up with correct diagnoses nearly 70 to 80% of the time. Now they took a section of their cohorts that were matched for age and abilities. Those cohorts were not allowed to talk to their patients. They were only allowed to examine the patient. So that doctor listened to their patient's heart, listened to their patient's lungs, felt their abdomen, did a complete physical examination, but received no history. Do you know that the group of people that could only examine a patient without any history could only get the diagnoses correct on that patient 20 to 30% of the time? And if that particular problem was not manifesting itself at the time, the percentage dropped to even lower. I don't know that I can ever find this study again, and it's certainly not one that would be repeated in this day of doctors ordering tests. Let's just order a test, order a test, order a test. And the more tests we order, one of them is bound to tell us what's wrong with the patient. Except in the case of my wife, who died nearly 2 years ago at the hands of American medical care. They said her laboratory work was dead. They said that even after she was dead.